This looks good. Can you hear me? Just want to make sure that the microphone is working. Is that good? Yep, it's Mets country. Okay, it's 5 o'clock. I'm David Goldfarb. I'm the clinical chief of nephrology at NYU Langone Medical Center and the chief of nephrology at the New York VA. I'm a professor of medicine and physiology, and I'm the director of the kidney stone programs at NYU and the New York VA. So I'm pleased to be here. I've also been a co-writer of the patent that was used for Moonstone, basically a high citrate drink to have a couple of benefits, prevent kidney stones and possibly decrease the progression of chronic kidney disease. I want to start by talking about kidney stones. Kidney stones are about 50% genetic in origin, about 50% environmental. And when I say environmental, that involves what you're exposed to, what your diet is, what your fluid intake might be, and heat in particular. So there's a combination of factors that go into things. The genetic factors are not completely understood. We can find genes in about 10% perhaps of people who have kidney stones. There's some rare genetic diseases that some of you are familiar with, like cystinuria or primary hyperoxaluria, but most people will, although we say there's often a family history, most people don't have a clear genetic basis for kidney stones. When we look at the urine collections of people with kidney stones, we often find that they're just simply not drinking enough fluid. And the reason we think that kidney stones are so prevalent in the United States, and by that I mean about 11% of Americans will have at least one kidney stone in their lifetime. We think one of the reasons is because we're all eating a fair amount of salt, sodium. We're eating a fair amount of animal protein. And these factors change urine chemistry in a way so that if you have a low urine volume and particularly are not keeping up with the fluid intake that is required in the course of a day, all that stuff, all of that salt is precipitated in the urine. The most common kind of kidney stone is made of calcium. Most calcium stones are made of calcium oxalate. Oxalate occurs in a lot of plant materials and binds with calcium. And when calcium and oxalate get together, they don't come apart. That's the most common kind of stone. Some people have a lot of calcium in the urine. Some people have a lot of oxalate. Some people, of course, have both. And if your urine volume is low, then that calcium and oxalate are very concentrated there. You can prevent kidney stones with citrate. Some people have a low citrate in the urine. Citrate is important because if citrate gets to the calcium, it binds more tightly, prevents the oxalate from getting to the calcium. So I think of citrate as an inhibitor of calcium oxalate precipitation. And some people just don't have enough citrate in the urine. That can be related to diet. It's common in people with diabetes, people who are overweight, people who have a family history may have a low citrate in their urine. Some people have too much animal protein in their diets. That leads to a lot of uric acid in the urine and decreases the amount of citrate, which is not a good thing. And all of these things are exacerbated if your urine volume is low. In other words, if you don't take in enough fluid to keep all of that stuff, the calcium oxalate, dissolved. Besides calcium stones, there are people who have uric acid stones, and uric acid stones occur when the urine is acid. The uric acid likes to dissolve in a more basic or alkaline kind of urine, and people who have more acid urine will tend to precipitate uric acid. The good thing about uric acid stones is that they can be dissolved with enough alkali, enough base. Uric acid stones are easily preventable, just taking citrate as well. 1% of stones in the United States are attributed to cystinuria. That's a rare genetic cause of kidney stones. You lose cystine in the urine. Your genetic abnormality prevents the cystine from being reclaimed. There's too much cystine in the urine, and cystine is then poorly soluble and forms a lot of stones. And people with cystinuria tend to have bigger, more recurrent, and somewhat resistant to surgery kinds of stones. But that can be prevented both with dietary modification, with a lot of alkali, in other words, taking citrate, reducing salt and animal protein intake, and sometimes taking drugs like tiopronin, Thiola. Those are the most common kinds of stones. The other kind of stone that you may have heard of is struvite stones. Struvite stones occur in people with certain kinds of infections, particularly with a kind of bacteria called Proteus. Those bacteria lead to a very high urine pH, and those people wind up getting more kidney stones related to infection. I'm going to hang up that telephone there. So those are the most common kinds of kidney stones, and sorry, and those kinds of stones are present in up to 11% of people in the United States have a kidney stone. Kidney stones can be prevented. The first thing we talk about is how much fluid to take, and my prescription for fluid is 96 ounces per day. That's 3 liters. Everybody says 8 ounces times 8. No, it's 8 ounces times 12 is 96 ounces. That leads to a urine volume of 2.5 liters, and that is going to keep most kidney stones away, most calcium stones, uric acid stones, cystine stones as well. And I want you to think about, I try to tell my patients that this fluid prescription is a serious drug. Water is an effective medication. It prevents kidney stones. It's cheap. It's safe. It's very effective. It has one side effect. You just have to urinate more frequently, of course. But that may be sufficient for most people who are having infrequent and small stones. The next thing we try to do is modify people's diet. And diet modification consists of what we call the Borghi diet, B-O-R-G-H-I. That's a study. It was the only study that was ever done where a diet prevented kidney stones. The study was done in Italy. Unfortunately, it was only done in men, but we believe that it would do the same things in women, but that wasn't proven. The Borghi diet was the diet that showed that more calcium prevented calcium stones, not what everyone used to do, lower calcium intake. We think that more calcium leads to fewer kidney stones because calcium will bind oxalate in the intestine. So if you have some spinach, which contains oxalate, and have some yogurt to go with it, the calcium in the yogurt will bind the oxalate in the intestine and prevent its absorption into the blood, and therefore keeps it from getting into the urine. So the Borghi diet had 4 parts: more calcium, less salt, less sodium, because that increases the amount of calcium in the urine, less oxalate, because that's what stones are made out of, and less animal protein, because animal protein, as I said, leads to promotion of kidney stones. The other part of the diet that we really want to promote is more citrus, because citrus has more citrate. Citrate, again, binds calcium, prevents it from binding to oxalate. So we like to push lemons, limes, and other sources of citrate, watermelons, cucumbers, all of those kind of watery vegetables have some citrate in them. And if you eat less animal protein, the amount of citrate goes up because animal protein is a source of acid. Acid is bad for kidney stones and promotes a lower urine pH and less citrate in the urine. So less animal protein and more citrus. That's the diet. And then if it's necessary to do something more, we want to promote some medications. And the medication that I give a lot of people, of course, is potassium citrate, because citrate prevents kidney stones. It's relatively well tolerated. Some people don't like those pills. Moonstone is a drink that my partners and I, Brian Eisner at Harvard and Mass General Hospital, and Marshall Stoller at the University of California at San Francisco, we invented it because we realized that there really wasn't a drink that was high in citrate that could prevent kidney stones. There's other stuff out there that's relatively low in dose, and that therefore doesn't give you enough citrate. You have to take a lot of that stuff. And even lemons and limes, which Marshall Stoller was one of the authors that demonstrated back in the 90s that lemonade could change urine chemistry, you'd have to drink the juice of a lot of lemons to get there. So we invented Moonstone basically to come up with a solution. When our patients asked us, should we drink this or that, we say, mostly you're going to drink water. But if you want to drink something else, we're going to come up with a drink. So our patent was licensed by Dr. Arnie. Dr. Arnie's is a company that's making this drink. The drink is now available on Amazon and on Moonstone Nutrition. Of course, my disclosure is that I own a little tiny piece of the company, probably less than 2% of Dr. Arnie's. So I'm doing this as our motto. Democratize kidney stone prevention means that we wanted to make a drink that was available over the counter. You didn't need to see a doctor, well tolerated, inexpensive, So that's our goal with Moonstone. The other thing I'll say a few words about is, and somebody asked me this question about chronic kidney disease. There's a lot of evidence, but it is not yet definitive that alkali, and that citrate is a good source of alkali, might decrease the progression of chronic kidney disease. And the theories about this are that your kidney, in order to get rid of acid every day, your kidney makes ammonia. And that ammonia is useful to get rid of acid, but there might be effects of ammonia as well on the kidney that are adverse. It might lead to some scarring, fibrosis, and a variety of inflammatory changes in the kidney. So this, and there are other mediators perhaps of progressive kidney disease. So there's a lot of data out there. Don Wesson, as an example, he's an author of a number of great papers, really well done, conducted studies in University of, he's at in Dallas, and Don's studies have demonstrated that people who took alkali, bicarbonate or citrate, had less progression of chronic kidney disease. So we definitely promote this when we don't know what else to do, and your chronic kidney disease is getting worse, and we've lowered your blood pressure, and you stopped smoking, and we gave you an ACE inhibitor or an angiotensin receptor blocker, a variety of drugs that we think are good for kidneys. When we don't know what else to do, we give pretty much everybody some sodium citrate or some potassium citrate if they're depending on their kidney function, and try to increase their serum bicarbonate concentration. I'll just basically say that the data demonstrating that this is really effective is not yet available, but we do think it's safe. We think it's inexpensive. And so I certainly encourage this in my patients who have chronic kidney disease, because it's likely to be useful, and it's not going to cause any harm. So Moonstone certainly is potentially useful in that setting. It is a high citrate drink, therefore it's providing alkali, and could be considered a treatment for the kind of mild metabolic acidosis that patients with chronic kidney disease have early on, and it could be associated with long-term benefit. Of course, we haven't demonstrated that that's the case, but it's something we think about in all patients we take care of with chronic kidney disease. One question that I was asked here today is about the keto diet. Does it cause kidney stones? The keto diet is a diet, of course, that is a low carbohydrate diet. It's very popular in the United States. The first version of the keto diet really was the Atkins diet. South Beach is a kind of a version of that. And the keto diet is one that it does promote kidney stones, is the answer, yes. We think that happens because it promotes ketoacidosis. And I've sort of talked about the fact that acid leads to less citrate in the urine. The kidney holds on to citrate, a base, an alkali, holds on to that and says, well, there's too much acid around. Let's absorb citrate from the urine. And then there's less citrate in the urine to bind up the calcium. So that's a big way that the keto diet promotes kidney stones. Similarly, there's a drug called topiramate, brand name Topamax, very popular for treatment of migraine headaches. And that does a similar thing. It's a little bit like the keto diet in terms of how it changes urine chemistry. The citrate goes down, and those people tend to get kidney stones. And when I tell people to stop taking their Topamax, they look at me as like I'm crazy, because it really can be a very effective drug for some people with migraines. So the keto diet, we think, is adverse. It's possible that you could overcome the effects of the keto diet on the risk of kidney stones by taking enough alkali. I actually have heard stories that Dr. Atkins would give potassium citrate prescriptions to patients with a history of kidney stones before he put them on the Atkins diet. And so, if patients think that the keto diet is important for weight loss, and some people, certainly some of my patients, of course, think it's important and useful for maintaining their weight, then I don't tell them, no, you can't do the keto diet. What I do say is take some citrate. Either take a potassium citrate prescription, which I can write for you, or try the Moonstone and see if that helps change your urine pH, get it, keep the citrate in the urine on the higher side. So that is a good example. Magnesium citrate, people have commented on here, is one of the components of Moonstone. I'll tell you that, again, with my I have it, my disclosure is that I own a little tiny piece of the company. But one of the great things about citrate is that that we did in Moonstone was we used all the different forms of citrate. There's some magnesium citrate. If you took too much magnesium citrate, that's a laxative, right? You use that as a laxative, a cathartic. Some sodium citrate. Well, we don't want to have too much sodium because sodium has some effect on blood pressure. Sodium can increase the amount of calcium in the urine. And of course, potassium citrate is a prescription that I've written a few thousand times for my patients. Potassium citrate does lead to some GI intolerance. Some people get some heartburn from it and the like. So what we did with Moonstone was combined all of those, some magnesium citrate, potassium citrate, some sodium citrate. That way you don't get too many of the side effects of any one of those forms of citrate. And that sort of avoids some of the side effects that you could have with any of the other citrate preparations. People are asking about fluid intake during hot times. This is something I've written a bunch of papers about. There's no question that in hotter places like Texas, Florida, the south of the United States, there are clearly higher rates of kidney stones. And the simple way that this happens is that if it's hot, you're losing water through your skin, and water that's coming out of your skin, even if you're not clearly perspiring, even if you're not wet, the water that's coming out of your skin is reducing the amount of water that's going through your kidneys. So we definitely know that kidney stones are a seasonal problem. They occur more in the summer than in the winter. There are more emergency room visits and more urologic procedures. All of that's been demonstrated. And we simply have to tell people, you have to keep up with your fluid. So when I tell people to drink 96 ounces or 3 liters per day, I want to say that's the goal, to keep up with that fluid intake. But you may need to drink 4 liters or 5 liters if it's really hot. If it's summertime and it's July and it's 105 degrees, you may have to drink 5 liters to get your urine volume up to more than 2 or 2.5 liters. This afternoon, I was at my kidney stone practice. I saw a patient. He and I like to talk about bike rides. You can see the bicycles on my back shelf there. We were talking about bike rides. He described riding 80 miles this summer. He's 75 years old. He does once a week, he does 60 to 75 miles or so. And he went that entire bike ride without urinating. That's not unusual. Then you just have to keep up with your fluids. Moonstone's one of the things you can drink. Certainly keeping up with your fluid and making sure that you're urinating at hot times in the summertime in Texas on bike rides is certainly appropriate. And in order to keep up with those fluids, you need to be taking in a variety of things. We were really inspired to make Moonstone when we did a study on Gatorade. People asked us, well, can I drink sports drinks? Gatorade does have some citrate in it, but we demonstrated in a study that we published that after drinking Gatorade, we were drinking a liter or more a day. People demonstrated that we did not get the citrate in the urine up very much, even though Gatorade had citrate in it. Gatorade is a good rehydration solution, which means it's got some sodium in it. And if you're losing salt, you definitely want to go with some more sodium containing fluid like Gatorade. But if you've got kidney stones, you need that citrate. And we demonstrated that Gatorade just didn't change urine chemistry well enough to prevent kidney stones confidently. So when our patients asked us, as they often did, should I be drinking sports drinks? Can I drink clear sodas? All of those things, we studied them. We did 24-hour urine collections in people who drank diet orange soda. We did Gatorade. We did another exercise-related drink called Performance. And we didn't change urine chemistry. And that's when we realized we could make a drink, do better, get more citrate into the urine, and help prevent kidney stones. Let's see, what else? What other questions? People are asking about bariatric surgery. And that is a very popular item as well. Of course, in the United States, people are having more bariatric surgery to deal with weight loss. And we do think that there's a couple of ways that bariatric surgery will be related to more kidney stones. The gastric sleeve is less of a problem. The issue, of course, is that in patients who have had kidney stones previously, we say you've got to overcome that feeling of satiety, right? That feeling of fullness, and you've got to keep up with your fluid intake, because the purpose of that gastric sleeve is to decrease the size of the stomach, in essence. And so people may feel that they get bloated if they drink more fluid. Those are people that we would promote citrate use for if they can drink citrate, drink Moonstone, or even take potassium citrate pills. That's a way of dealing with that gastric sleeve. The other procedure that has been popular is the Roux-en-Y. The Roux-en-Y is a kind of a gastric bypass procedure. That's associated in the long term with an increase in the amount of oxalate in the urine. That is related to fat malabsorption. People absorb too much oxalate from the food that they eat, and that can be very difficult. That may not respond to citrate administration so readily. So people who have Roux-en-Ys have high oxalates, and cutting down their oxalate intake is fine, but often doesn't work. We want to give those people a lot of calcium. Calcium will bind oxalate in the intestine and prevent it from getting into the blood. So that can be useful. And we very often will give citrate, but all of these things may not be effective in all patients. And keeping up with your fluid intake is obviously very important. So that, it's very rare, but we've seen some patients who often have decreased kidney function, which is a bad thing as a result of high oxalate after the Roux-en-Y procedure. How about plant-based foods? That's a great question. So my friend, Dr. Joshi, who's up the street, up First Avenue at Bellevue, just put in a grant to the National Kidney Foundation to study both the keto diet and the plant-based diet and look at urine chemistry. We're pretty sure that the plant-based diet is a good one for kidney stone prevention because you're going to have more citrate in your urine. That's number one. Vegetarians clearly have fewer kidney stones than meat eaters. So we think the plant-based diet is a good choice. And I spoke earlier about the fact that we want to have less animal protein and more plants because that is a source of citrate. So we definitely like that and promote that. Certainly in New York City, of course, it's not so easy to get people to become vegetarians, but more people are getting into the plant-based diet. They all watch that Netflix thing. And people ask me about that. And from the kidney stone point of view, it's a good thing. It's interesting that people who eat more plants, more vegetables, will have a little bit more oxalate in their urine. And you'd think, well, that's not good. Yeah, that's true, except that they have more fluid because if you eat melons and citrus, orange juice, and lemons, you get more fluid in your intake, and therefore you have more fluid in your urine. Plus, you get more citrate. So that overcomes the fact that there are plants that are high in oxalate. There's a Harvard School of Public Health website. If you're interested in oxalate intake and want to see that, just Google Harvard School of Public Health oxalate lists, and you'll find the best information. The reason I say it's the best information is because those data were generated by my friend, Dr. Ross Holmes at the University of Alabama at Birmingham. Ross is really one of the world's experts on measuring oxalate. So you can find that list online. People will say, well, this list says this is high in oxalate, that's low in oxalate. What's the best information? We just send people to that Harvard School of Public Health website for the best oxalate information. So yes, there are vegetables that are high in oxalate, but you can overcome that by having lots of citrates, and that citrate could come from citrus, from melons, and from Moonstone. That's one way of dealing with some of those higher oxalate foods. The other thing we like to say about oxalate foods is that if you're eating spinach, have some yogurt, bind up that oxalate. Make sure you drink it with, have that spinach with lots of water to go with it so that when you pee out the oxalate, you do it in a larger volume and the urine is more dilute. I like the questions here about preventing uric acid stones, and about alkali. Let me just say something about that. Uric acid, I told you, precipitates with more acid urine, and so you want to alkalinize the urine. What happens to citrate is two things. Citrate winds up in the urine in patients with calcium oxalate stones, and the citrate binds the calcium. The other thing that happens to the citrate is it goes to the liver where it's metabolized to bicarbonate. Bicarbonate is, basically baking soda is sodium bicarbonate. And that has an effect to buffer acid and increase the pH of the fluid that you add it to. If you add baking soda to what you're baking, the pH goes up. And if you take sodium bicarbonate by mouth, your urine pH will go up. You'll just pee out that sodium bicarbonate and your urine pH will go up. If the urine pH goes up, uric acid dissolves cystine dissolves. So we're using citrate, and whether that's in potassium citrate or as Moonstone, we're using that to increase the pH of the urine. We are also increasing the citrate of the urine. So citrate has both of these effects depending on the kind of kidney stone, and it's really why we can confidently say that citrate supplementation is appropriate for any kind of kidney stone. We probably don't have any effect on struvite stones, those kinds of stones that are associated with infection, but we will pretty much deal with every other kind of stone. Either you need more citrate to bind calcium, or you want the citrate to get metabolized to turn it into bicarbonate and increase the urine pH. Certainly sodium bicarbonate works for lots of people for uric acid stones, but the reason why we try to avoid sodium bicarbonate, it's cheap, it's easy to get, and pay $3 for a box of sodium bicarbonate, right? It's fine. But for calcium stones, more sodium in the urine will lead to more calcium in the urine, and that's adverse for calcium stones. So that is not the preferred way to change urine pH. My strong preference to change urine pH would be to use potassium citrate, and Moonstone's got a little, as I said, sodium, potassium, and magnesium citrate. Kind of spreads out those cations, the positive charges that are there. Somebody is having a kidney stone removed tonight, a stone that's stuck, and I hope all of that goes well. I will say that uric acid stones and cystine stones can be dissolved. You can increase the pH of your urine dramatically, and those stones will dissolve if you can effectively get the urine pH to 7 or more. For uric acid stones, my goal is to get the pH to 7. If cystine stones, 7.5 or higher. So we have occasionally dissolved kidney stones successfully without going to the operating room, without having ureteroscopy. So that's something certainly to think about. Calcium stones, on the other hand, will never dissolve. Calcium stones are stuck together, like calcium and oxalate or calcium and phosphate bind together. They will not come apart. You would have to get to a pH of 1. You have to add hydrochloric acid to a calcium oxalate stone to get it to dissolve. So that's a stone that, those kinds of stones, we can prevent them by giving citrate. I just want to emphasize that you can prevent recurrent calcium kidney stones, but you cannot make them go away. And I'll tell you that from a scientific point of view, all the stuff that's available that claims to help stones pass, honestly, I don't believe it. I think the studies have generally been negative. I don't think that promotion of stone passage occurs. You can't break stones that are in place. You can only dissolve uric acid and cystine stones. So there's lots of stuff available that with a claim of kidney stone passage. There's some controversies about whether Flomax, that's a drug that's used for that may promote kidney stone passage. It's most often used in men with prostatic hypertrophy, big prostates. And that can help them empty their bladders and urinate less at night. So those alpha blockers like Flomax is popular, Hitrin is another one. Those drugs have been promoted to help pass kidney stones that are stuck in the ureter. Ultimately, those studies have really not shown great benefit. Currently, urologists in Europe are not using alpha blockers, but the American urologists are still using them. They basically think they're relatively inexpensive. They may work, they may not, but they're safe, not dangerous, and very often promote some use of Flomax would be an example to take once a day. I'll say that if you have a small stone, it's probably going to pass, and therefore it would be hard to show a benefit from Flomax. If you have a bigger stone, it may not pass, and it may be difficult to show a benefit from Flomax. So the studies have really been equivocal regarding whether that class of drugs, the alpha blockers, can help pass stones. What else can I tell you about? Your fluid intake, of course, is important. And Flomax, can you take it for a long time? The answer is, either you pass the stone or you don't. So usually when I give people Flomax, I give them 28 days. And I say at the end of that, you got to go see a urologist and get that stone taken out. That's assuming that you've been able tolerate the pain for 28 days, and that may happen if you have a partial obstruction or a small stone. You may be able to go through that whole thing. When can I start taking potassium citrate if I just had a lithotripsy? Um, I'll tell you that people who are going to have lithotripsy should be taking their potassium citrate before they have the lithotripsy and immediately after. I mean, that day or the next day. There's a couple of studies that I think are pretty convincing that shows that you'll pass more fragments after your lithotripsy, right? Lithotripsy, ESWL, extracorporeal shockwave lithotripsy. We usually call that SWAL. That's a external shockwave beam. It's not sound waves. It's not ultrasound. It's a shockwave that's basically taken up by a kidney stone and fragments it into pieces. Those pieces appear to pass more readily if you take potassium citrate. So I emphasize to people who are going to have a lithotripsy, take your potassium citrate before, during, right afterwards. You know, as soon as you wake up, get your potassium citrate, drink a bottle of Moonstone, and maybe you'll pass more fragments. So I think that's an important question. You should just keep taking it all the time. What's the recommended dosage of potassium citrate? You know, that's a reasonable question. I'll tell you this: if I knew what your urine chemistry was, I might give you anywhere from 15 to 30 milliequivalents twice a day. That would be 2 potassium citrate pills, 15 milliequivalents, and 2 potassium citrate pills is also the same amount of potassium citrate as in 1 packet or 1 bottle of Moonstone. So we usually think about this instead of milligrams. It's easier to compare one solution to another as milliequivalents. So 1 packet of Moonstone is 30 milliequivalents. And if you took that half a packet twice a day, I think most people would be doing pretty well. People, if you know that your citrate's low and you know a dose of potassium citrate that you're taking, then 1 packet twice a day might be appropriate. If you're taking potassium citrate pills, I'd say most of my patients are taking at least 15 milliequivalents. That's 1 big potassium citrate pill twice a day, or 2 of those 15 milliequivalent pills twice a day. Some people take it 3 times a day. I think that's perfectly reasonable. And if you want to drink Moonstone 3 times a day, someone asked me today, is it possible to have an overdose of citrate? It's a good question, and it's really, really hard to have an overdose of citrate, whether you're taking potassium citrate or Moonstone. The thing that could happen, it's more of an issue for patients with chronic kidney disease, is too much potassium. So the potassium citrate would be something where of course, people with decreased kidney function are at risk for hyperkalemia, a high potassium in the blood. High potassium, it can actually be lethal. You can lead to cardiac arrhythmia, and you can have bad things happen to your heart. Too much potassium citrate is potentially an issue. Again, that's an advantage of Moonstone. There's a little potassium, a little sodium, a little magnesium. We spread it all out, and that may be a better choice for people with chronic kidney disease as a result. People with who are taking citrate have to be careful as well about potassium, because very often they have decreased kidney function, 1. 2, they may be taking ACE inhibitors like lisinopril or angiotensin receptor blockers like losartan. Those are drugs that tend to increase the potassium in the blood. So those are instances, again, where we try to stay away from potassium citrate. Would usually promote sodium citrate or sodium bicarbonate. Because we don't like the sodium, we might be able to promote Moonstone as a way of dealing with citrate in patients who are at risk for high potassiums. So you can't die of too much citrate. I think everything's possible, and people find ways of doing everything to the point of danger. But citrate would really be a hard thing to be toxic with. But you can more readily become more toxic with potassium. So you've got to be careful about using potassium citrate in patients with chronic kidney disease, diabetes, in patients who are taking ACE and ARBs, those kinds of drugs. Patients with ostomies, I'll tell you this about ostomies. I saw a patient with Crohn's disease today, doesn't have an ostomy, but it's certainly something I've seen lots of patients with bowel disease. Bowel disease has a couple of different effects that leads to kidney stones. 1, when you have diarrhea, you are losing base, you're losing alkali. So those patients tend to have a more acid urine and will tend to have a low urine citrate. So the treatment for that is to give alkali, give citrate to those patients. Another problem with ostomies is that if you're losing a lot of fluid through your ostomy, that's fluid again that's not coming out of your kidneys. So I've certainly had patients who increase their water intake, increase their Gatorade intake, take more fluids, and they just have more stool, right? They just put out more fluid out of their ostomy instead of what's supposed to happen is having an increase in urine output. So that's one problem with ostomies. I find that it's very useful to look at 24-hour urine collections in patients with ostomies and every kind of bowel disease and bariatric surgery as well. I want to see how much citrate's there. I'd like to see that if I give you citrate, I increase the amount. I'd like to see that if you're able to increase your fluid intake, get more urine volume instead of having more ostomy output, of course. There's the other issue is people with ostomies can get uric acid stones. Their urine is acid, and under that circumstance, as I said before, they can have precipitation of uric acid, and that could be adverse. So we see both calcium oxalate and uric acid stones in patients with bowel disease. A bunch of my patients, since Moonstone became available, patients with bowel disease and ostomies have taken Moonstone and tolerated it very well. Some people do have gastric irritation and a variety of other abnormalities. And the other thing I really tell everybody that I give potassium citrate to is if you see those pills in your ostomy or in your stool after you move your bowels, that's normal. Those pills are big. They're called a wax matrix pill. The medication dissolves out and the pill is left behind. So those potassium citrate pills showing up in the toilet does not mean that pill didn't work or it didn't dissolve or it didn't give up its potassium citrate. It's something to be expected. And I tell people, if you see it in the toilet, don't call me. Okay, big uric acid stones. Kidney stone made somebody's blood pressure go up. Patients with kidney stones do tend to have higher blood pressure. And that is the reason why we don't want to give a lot of sodium, not a lot of sodium bicarbonate, a lot of sodium citrate. There's a tendency for people with blood pressure to have kidney stones and for people with kidney stones to have higher blood pressure. Exactly. There's actually studies that have shown that people with more blood pressure have a tendency to get more stones and vice versa. So exactly which one comes first is not completely clear. It's kind of easy to imagine if you have a bunch of kidney stones or a lot of urologic procedures that you'd be at risk for a decrease in kidney function, and that would be associated with an increase in blood pressure. But it goes both ways. The other thing is we like to talk about are shared risk factors. Basically, overweight and high blood pressure are things that are bad for blood vessels and will also lead to kidney stones. So it could be that it's the risk factor like overweight that is contributing to the kidney stones and to the high blood pressure. And that's a reason why, of course, weight loss is advantageous. And however you lose weight, I usually promote, I like Weight Watchers as a kind of a balanced diet. I talked previously about the fact that I just want to emphasize if you're on a keto diet or something like that, high protein, less carbohydrate, you want to just keep up with the alkali under that circumstance. The other thing that this reminds me of is to talk a little bit about bone density. People with calcium kidney stones tend to have lower bone density. And this goes in two directions. One, it's probably the case that some people have too much calcium in the urine because of an abnormality in the kidney. So you lose calcium in the urine. The result of that is that calcium gets mobilized out of bone, and that's adverse for bone density. So that's a kidney problem leading to decreased bone density. The other way around is also true. There's people losing calcium from bone, and menopause is an example of that. Calcium coming out of bone leading to loss of calcium in the urine, then the kidney is just an innocent bystander. It's being affected by that calcium release. Whether menopause is really associated with more kidney stones is not clear, but what is clear is that women who have decreased bone density or are just going through menopause are interested in what can they do to maintain bone density. One thing that is astounding, and it's completely true, is that citrate increases bone density. And the reason for that is because the bone is a buffer. It basically takes up protons, acid. If you eat a hamburger, you're basically eating acid, and some of that acid is going to wind up in your bones. So women who eat more animal protein have lower bone density. and we definitely promote a more plant-based diet, a more citrate-rich diet, and we promote the use of potassium citrate in patients with kidney stones and decreased bone density. Moonstone, I'm very confident, is going to increase bone density as well by neutralizing acid. It's going to have a positive effect. There's a nice study that was done by a nephrologist in Switzerland where they gave 60 milliequivalents of potassium citrate per day to postmenopausal women who did not have osteoporosis. So this was a healthy group who still had good bone density. They took 30 milliequivalents twice a day of potassium citrate, and their bone density, both in the vertebra, the spine, and in the hips, increased as well. So we're very confident that Moonstone will have a positive effect on bone density, and it's kind of a solution for that decreased bone density as well. But I will also point out that bisphosphonates, that's drugs like Flomax is the most commonly prescribed and well-known drug, have also recently been shown to have positive effects. If they're turning off release of calcium from bone, then they're also going to be associated with less urine calcium and better bone density. Megan Prochaska is a scientist and investigator and nephrologist at the University of Chicago, and Megan's study about a year ago demonstrated that people who were taking bisphosphonates had fewer kidney stones. So, you know, I definitely promote in my calcium stone formers who are women, and particularly in the postmenopausal women, getting a DEXA, a bone density measurement, and if their bone density is low, promoting citrate and bisphosphonates like Flomax. Taking calcium and vitamin D are not really that helpful. You know, there's multiple studies, including the Women's Health Initiative, that showed that if you took postmenopausal women with decreased bone density and gave them calcium and vitamin D, not much happened. There's a small increase in bone density, but there was actually no decrease in the fracture rate. Does vitamin D cause kidney stones? I think probably not. If you take vitamin D supplements, your body regulates the amount of active vitamin D. When you take vitamin D, you're taking a precursor of the active vitamin, of the active hormone. So vitamin D itself, you have to convert it to the active form when you take the precursor. And the amount of precursor that gets turned into the active form of vitamin D is limited by your body. It recognizes that you've got too much calcium in your body, and it prevents you from making too much vitamin D. So it's hard to get vitamin D toxic. On the other hand, it's really disappointing that the studies of vitamin D have not done much for osteoporosis, for postmenopausal osteoporosis, or any other form of decreased bone density. So I generally say, you know, I don't really care about vitamin D. If you want to take 1,000 units per day, I think that's safe. I don't think it's harmful. There's been a tendency lately of doctors to measure vitamin D levels and give high doses of vitamin D. The evidence that that's doing anything useful is really limited. Same thing for calcium. It sort of makes sense that taking more calcium would increase bone density, but it's true if you take calcium via diet through dairy products. It's not so true if you take calcium pills. So in the Women's Health Initiative, a study of postmenopausal women, they gave them calcium pills, and they doubled their rate of kidney stones from 1%, a low number, to 2%, still a low number, but they doubled that rate of infrequent kidney stones. So taking calcium is certainly something that I don't usually promote. There's one of the reasons there's no calcium in Moonstone. And the other thing to think about is that if you really do have to take calcium because you're lactose intolerant, because you are not able to take enough dairy products for any reason, if you have to take some calcium pills, I suggest calcium citrate, right? That makes sense because citrate helps prevent kidney stones. And I suggest that you take your calcium citrate with meals, because then the calcium is serving not just as a calcium supplement, but also as an oxalate binder. So again, if you're going to take a calcium pill because that's the only way for you to get enough calcium to maintain bone density, take it with meals, and you're also using it as an oxalate binder. So that's my suggestion, that citrate and alkali are good for bones and not calcium pills. Regarding Moonstone, the question is over the counter. Yes, it's available on moonstonenutrition.com. It's available from Amazon as well. It's over the counter. At the moment, you know, it doesn't say prevention of kidney stones. We have not yet done the studies that demonstrate that it prevents kidney stones. We're confident, based on a lot of past literature, that this is effective for stones, and I suggested for chronic kidney disease as well, but it's over the counter right now. Nina asks about magnesium malate. Malate is an organic anion. It's like citrate. It will increase the amount of citrate in the urine. It will increase the amount of bicarbonate in the urine. The only issue with magnesium malate is that if you take enough of it to change urine chemistry, you might have a cathartic effect of the magnesium. Your intestine is not very good at absorbing magnesium. So magnesium is commonly used as a cathartic. And so magnesium malate might have a positive effect. People also ask about magnesium. Does magnesium prevent kidney stones? And Moonstone does have magnesium in it. In a test tube, magnesium will help prevent calcium stones. Magnesium can bind oxalate and doesn't form kidney stones. So one of the ways magnesium, which is a positive charge like calcium, we think is positive, is that it binds to oxalate and increases the solubility of the calcium that's present in the urine. The only study that was ever done where people were given magnesium for kidney stone prevention didn't work. But I recognize that it has this effect in a test tube, therefore it might be useful. And one of the reasons why magnesium is included in Moonstone, because magnesium may have a positive effect. But you just have to be careful that if you push the magnesium too hard, you wind up with diarrhea, and of course that's a bad thing. Shirley asks, how do you know what kind of kidney stones you have if you haven't passed a stone? It's a good question. If you have a plain X-ray, that's called a KUB, kidney, ureter, bladder, a plain X-ray will show up a kidney stone that's made of calcium. It will not show a stone made of uric acid. Plain X-ray will not tell the difference between a calcium oxalate stone and a calcium phosphate stone, but it will tell a calcium stone of any kind from a uric acid stones. Cystine stones are variable. Some of them show up on KUB, a plain X-ray, and some of them don't. Nowadays, CAT scans are being used to tell kidney stone composition. The radiologist can easily measure the density of a kidney using software, can measure the density of a kidney stone, and they rate the density as Hounsfield units, HU. 500 HU is the kind of the breaking point. Anything more than 1,000 is definitely a calcium stone. Between 500 and 1,000 is kind of probably a calcium stone, and anything less than 500 is probably a uric acid stone. So you may not know. You definitely want to encourage kidney stone analysis. If you pass a kidney stone, you want to give it to your urologist or nephrologist and make sure that it gets analyzed. You have to make sure that you don't have a rare stone like cystine stone, and you really need to make sure that that gets analyzed. How much does it cost to get a kidney stone analyzed in the United States? $30. Amazing bargain. So there's no excuse for not getting a kidney stone analysis. And if you've got one at home, take it to your doctor tomorrow and get it taken care of. People ask about lit control, pH up capsules. I'm very familiar with the company and what it's promoting. It's promoting, however, an increase in urine pH through mechanisms that I personally don't have any experience with. So I have not really signed on to be looking at that. The other thing that that company has been looking at and promoting is that decrease in urine pH. And I'm going to basically come out against lowering urine pH, making it more acid. When would you ever consider that? The kind of stone that's a little bit, remains kind of controversial is the calcium phosphate stone. Calcium phosphate stones occur in more alkaline conditions. So you might think citrate is bad for calcium phosphate stones because they make the urine more alkaline. But citrate prevents every kind of calcium stone. So I believe, and when I say I believe something, it means it hasn't exactly been proven, that more citrate will prevent calcium phosphate stones. And that's something I certainly promote, especially when people are drinking more water and making their urine more dilute. So if calcium phosphate stones occur in a more alkaline urine, you might say, well, then let's acidify the urine and that will help prevent calcium phosphate stones. Yes, but that acidification is going to be bad for your bone density. So, we did a study, Litholink and I did a study a few years ago where we gave a drug called sodium thiosulfate. We were thinking about whether it could help prevent kidney stones. And we showed that the urine pH went down. And people said, why don't you use that then for calcium phosphate stones? And we said, because we think that in the long run, if anyone was going to take that, they would have acid accumulation in their bones and have a decrease in bone density. So we vetoed the idea that we were going to decrease pH, and I'm not in favor of those. You could do that in the short run, acidify the urine perhaps in the short run to dissolve a calcium phosphate stone, but more than a couple of weeks I think is not a good idea. Okay, what about caffeine? Thank you. That's something I like to talk about. I'm a kidney stone former, right? I think many of you know that. I had 3 kidney stones, and that's proof. My wife says, since I'm a kidney stone doctor, that I'm a narcissist. I'm studying my own disease process. Well, but here's the thing. I start the day with several cups of coffee. I'm going to end the day with a couple of cups of beer. And that's because every study, and I mean there's a lot of them, every study showed that people who drink coffee prevents kidney stones. Yeah, there's some discussion about whether coffee increases or caffeine increases calcium excretion in the urine. That may be true. But every study that showed that people who drank more coffee had fewer kidney stones. Same thing is true of alcohol. So, I'm not here to promote alcohol use, but most of you know that 1 or 2 drinks a day is useful and may increase life expectancy in a variety of ways. Well, it's also true that every study, and I mean every study, has demonstrated that alcohol was associated with fewer kidney stones. Not driving while intoxicated, okay? I'm not here to promote a message of irresponsibility. But, and this is true, we've mixed our Moonstone with vodka, gin, mezcal, and tequila, all great. So alcohol, coffee are often thought to have adverse effects on urine chemistry. I don't think that's the case. If they have short-term effects on urine chemistry that are adverse, the studies show that people who drink alcohol have fewer kidney stones. People who drink coffee have fewer kidney stones. So that is part of your fluid intake, right? It may not be easy to get to 96 ounces per day, but what I tell patients is your coffee counts, your tea counts. If you have a couple of sodas, okay, what about soda? A popular topic. Soda has sugar. Of course, it's bad for obesity, for overweight, diabetes. You want to avoid that. So we do promote diet sodas, and all the clear sodas, Diet Orange, Mountain Dew, ginger ale, clear sodas have some citrate in them. Not very much, not like Moonstone, but they've got a little bit. We avoid colas because colas do have phosphate, which is adverse, and can lower urine pH a little bit as well. So usually 1 soda a day is something that I accept. So to conclude about fluid intake, coffee, tea, a beer, some Moonstone, all of that is going to go towards your 96 ounces per day. And what I say to my patients is, think about it. If I call you tonight, if Dr. Goldfarb calls me and says, how much fluid did you drink? I want you to be able to say, I drank 102.73 liters of ounces per day. In other words, you want to have some idea about how much fluid it is. You want to look at the dose that you're planning for the day and say, there it is, it's in my refrigerator. That is the 96 ounces I'm going to drink today. Have some idea of what that fluid looks like. If you're drinking a small bottle of Poland Springs, that's a half a liter. You need 6 of those to add up to 3 liters. That's the small bottle that is, $1.25 at Grand Central Terminal. So you really want to be thinking of fluid intake as a dose of a powerful, safe, effective, inexpensive medication. And if you put in a bottle of Moonstone or a packet of Moonstone in there, you're changing urine chemistry in a way that water does not do. Let's see, we have a few minutes left, and a couple of questions about people having a lot of kidney stone surgery. Let me say that the one thing that people ask all the time, Should I have a urologist or a nephrologist? Um, Nephrologists may sometimes be like me, a kidney specialist. I'm not a surgeon. I'm interested in in medical management and prevention. Um, Nephrologists are sometimes more interested in prevention than urologists. But the urologists who really do a lot of kidney stones are people who very often understand 24-hour urine chemistry, who know how to change that and use the treatments for that. And there are that group of surgeons are called endourologists. Endourologists are surgeons who have trained to go inside, that's the endo part, to get in the urine, to go up through your bladder, up the ureters, and take care of, you know, a combination of kidney stones and tumors in the kidney, cancer in the kidney. And you want an endourologist to do your complicated, if you've got lots of stones, you would really like to see someone who specializes in kidney stones. There's somebody in every city who is an endourologist who did a kidney stone fellowship. And those urologists are particularly, you know, comfortable with the medical aspects as well as the surgical aspects. And those are people that I work very closely with, of course. Um, can kidney stones cause bladder weakness? I don't think that's the case. No, I do think that people with bladder issues may have more kidney stones for a couple of reasons. I think they're kind of obvious if you think about it. I have lots of patients who have prostate issues that are common in men. Women tend to have some incontinence as they get older. People then automatically decrease their fluid intake. And so that is an issue. If you ask a man, how much fluid do you drink? They'll often say, older men, you know, 60s and 70s, I'm decreasing my fluid intake because I have to get up all night to pee. I have that urinary urgency that many older people experience. And so when I say increase your fluid intake, they look at me like I'm a sadist. And I get that. So I would much rather give those people potassium citrate pills, change the urine chemistry using medications. Obviously, you are not going to want to drink a bottle of Moonstone before bedtime if you have prostate problems. So I do think that people with bladder, those so-called lower urinary tract symptoms, have more kidney stones because they're cutting down on your fluid intake. That may not be all of it, but I don't think it goes the other way. Are there patients who can't increase the citrate in the urine? The answer is definitely yes. And most of those are patients with bowel disease, patients whose stool output prevents it from prevents us from being able to alkalinize the urine or increase urine citrate. And those are the patients where they may really have to take large doses of citrate pills or drink a lot of bottles of Moonstone. So those are definitely issues. People are asking about sugar and calories. You know, one of the things we did, obviously, in Moonstone, it's only 30 calories per packet or per bottle. There's no added sugar. The sugar that's in there, the 30 calories, comes from juices, natural juices that are in the drink or in the powder, and there's a little bit of allulose, a synthetic non-absorbable carbohydrate that's a sweetener that was approved by FDA a little bit more than a year ago. So there's no added sugar in there, and that's clearly because sugar does contribute to more calcium in the urine, and of course, overweight is such a common problem. Diabetes is such a common problem, both of which are associated with more stones, that we wanted to limit calorie intake. What about reclast? I'm a reclast fan. Reclast is zoledronic acid. It's used for bone density. There's no study that shows that reclast is associated with fewer kidney stones, but I'm confident that that'll work. And I've had that conversation with at least 3 women this week already. There was a study in the New England Journal a year ago where women with osteopenia, in other words, decreased but not that bad, not osteoporosis, were given reclast. That's a once a year infusion, and they had better bone density at the end of the study. So I'm a reclast fan. Get it out of the way, get an injection. You're done for a year. I'm confident that reclast, like other bisphosphonates, like Fosamax, will lower urine calcium and be associated with fewer kidney stones. But that hasn't been tested, and those data in the New England Journal did not demonstrate that. How about fasting? How about intermittent fasting for weight loss? Pretty interesting. And I would say that, I've read a lot of data about intermittent fasting. I don't have a lot of patients who have actually been through that. I'll just point out that that has to include water, right? You just can't go 16 hours from breakfast to dinner not taking in any water and expect to prevent kidney stones, right? I don't think that intermittent fasting is going to have an adverse effect on urine chemistry. I don't think it'll promote stones from any other point of view. The issue, of course, is that you've just got to keep urinating, right? You got to take in the fluid and maintain that urine output. I want to tell you, I want to thank Divya Menon for setting this up. People at Moonstone have been great in doing exactly what we wanted to do, and that was promote an inexpensive over-the-counter medication. They made it something that I think is delicious. I want to thank all of those people for supporting our scientific enterprise. I want to thank all of you for being here today. I'm sorry. I'll try to answer a bunch of other questions later via text, because I'm sorry we didn't get to everything, but I hope you all found this interesting, and we'll try to do it again sometime in the future. Have a great day. And wash your